Hi, my name is Carrie. I'm with Unity Point Health Finley Hospital here in Dubuque, and today I am with Sue, who's with our Lifeguard Air Ambulance crew out of Cedar Rapids. Sue, would you introduce yourself for me?
I'm Sue Minks. I'm with Lifeguard Air Ambulance. I'm the flight paramedic on shift today.
Awesome. Well, Sue's here today to talk to us a little bit about what happens if a patient comes to Finley and needs maybe a higher level of care. So when that happens, what happens on your end? Finley makes that phone call. Tell us about that process.
When they make a phone call to our dispatch then calls us or tones us out for we have received a request from Finley Hospital to go to unsaid hospital. At that time, our pilot then goes into the office, checks his computer, checks the weather, because as we know in Iowa, the weather can change within 5 minutes. During the course of their shift, they're always checking weather constantly anyway. Once he accepts the mission, he then lets our dispatch know that, who then calls you and lets you know that we'll be on our way in this many minutes. At that time, then we also receive what type of a patient it is, whether it's a trauma, a medical, if you have a destination in mind.
So as a paramedic, you get that patient information and you're getting ready. What do we need and what are we going to do to make sure this patient is safe in our care and we get them to where they need to be? Is that correct?
That's correct.
Awesome. So once you get to Finley, what happens next?
So when we get to Finley, we will approach the patient and the staff. We will usually get a report from the staff who's been taking care of the patient and or the physician that's been taking care. We'll also then approach the family if they're there so they can kind of tell us what's been going on with the patient also. They are moved from your equipment to our equipment, which includes a monitor at all times, possibly a ventilator if they've been intubated. If they have any infusions going, we move that over to our equipment also because we can't transport with, obviously we can't take your equipment out of the hospital. We get a full report along with any paperwork that needs to go. And then we go into the helicopter and reload them.
So is there an opportunity for you to communicate with family members who are still on the ground while you're in transport?
If the family is there with the patient, we usually obtain all the phone numbers and who they want us to call once we arrive at the destination so that we can give them an update on how their family member did.
Okay.
We usually try to make a point also, if we're flying out of Finley, to call you guys back, whether it's ICU or the ED, and give you an update on how the patient did during the flight.
Good. That's awesome. So a flight from Dubuque to Cedar Rapids would typically be about
25 minutes roughly.
Okay.
And again, it all depends on the weather. If we have strong winds coming through, we'll get here quicker if they're going to the east and maybe slower back.
Okay.
It's all depends.
Sure. Sue, is there anything else that you can think of that our watchers may want to know today?
I feel like you need to know that not to approach the helicopter from the back. Stay away from it at all times. If there's something blowing around, like if you have your baseball cap on and you blow it off, don't chase it towards the helicopter. Sure. And always make sure that you are in view of our crew. We have windows on 3 sides and make sure that we can see them.
Makes a lot of sense. You gotta keep everybody safe.
Everybody's safe.
Good. Well, thank you so much for being here. Thanks for tuning in. We sure appreciate the service that Lifeguard Air provides to Finley Hospital in our partnership with St. Luke. So thank you very much.